All right. Well, it's afternoon and it's right after lunch, so I hope I keep you awake, energized, and I hope you can keep up with my pace as I have 10 minutes. And I was so excited when I was asked to come here and share some of what we do that I put so much in there about examples. So you might not get to hear all of them, but at least we'll touch on a few of those. I wanted to start by again really thanking the planning of this meeting and including us into this in this work, which is really critical as we look at the future and where health in the community fits within health in the workplace. I think contrary to you might heard earlier, I think it all starts with individuals. That's how we see it. It's about me. It's about my health, my well-being. It's certainly what matters to me is going to impact how I behave, whether in a community or within workplaces or others. The workplace, we see that's an extension or the second cycle here, which really is about where people spend most of their days, their nights, their weekends, their life. And really the workplace does have the opportunity to impact behaviors, to impact and spread that across and be more contagious to actually reach communities and where we operate or where we live. And I think it's very critical for us from a business perspective to own that right to be in communities where we operate. And I think that's a point we have to keep in mind, that there is it's a right that you achieve by being in this community, and you have to give back to the communities. Healthcare system, we heard some, today about healthcare system and where it fits. Certainly it is an extension of how health or healthy healthcare system are established. And part of this is not about the healthcare system itself, but about people who are in the healthcare system, physicians, nurses, technicians, nurse practitioner, all of those. We have seen and we know that as an employer, certainly their data does not show us that they are leading by example, and I hate to say that. This is an opportunity for us to really also work on the healthcare system. And then the healthy world really is impacted, and it's vice versa, all impact each other. Policies and things that impact behaviors as well as impact healthcare, and the things that can be modified are impacted on a global base. We'll share with you some example on all these dimensions as I go further. Now, I was asked to reflect on strategies, to reflect on action and impact. So I think I want to start by saying, from a business perspective, and whatever business you're looking at or addressing, what's in it for them? Within Johnson & Johnson, we see it as part of the fabric of Johnson & Johnson. It is really stated in our, what is called the credo. And the credo is really the value system that we operate under. And you can see here, really, first responsibility is to customers, doctors, nurses, patients, and mothers and fathers. But again, the second one is where I do most of my life spent in taking care of our population health for the last 30 years or so. And how are we impacting culture of health in the workplace and creating some program that actually are transferable. But if you look here, responsibility to the community in which we live and work, to the world community as well. Now, this was established about 70 plus years ago by General Johnson back in the days. The last one, which I did not include here, if we do all these things right, we'll have a positive return on the investment for the shareholders. So I want to say it's all about, leading with a purpose, and each business have to have what is their purpose to help and support community health, and that you have to accomplish upfront. I know I'm talking fast, but I want to make sure I cover some of the example with you. From a strategy perspective, and I think that's another point I want to touch on, really our approach to improving global health is focusing on three areas: saving and improving the lives of women and children. Women and children are the top in our strategy approach. Secondly is really addressing the unmet needs, so preventing disease among the most vulnerable, where the needs are and where can we make a difference and impact beyond what we do elsewhere. And the third one is about strengthening the health workforce. We are in healthcare. We do care. So I think that these two together, we want to impact the healthcare. And I'll share a couple of examples on what does that mean. But the one point to make here, we also selected those specifically knowing where we can play, where do we have expertise, and where not. It, again, as mentioned earlier through our IBM speaker, it's not about giving money. It is really about how can we make a difference, not just by giving money, but it is really, can we use our expertise to make an impact? Not going to take you through that, so don't worry. But these are our actions are really have to have global reach. We are a global organization and certainly have to have regional focus. And when you look at community health and how these programs are selected and addressed, you have to know what are the needs and where can we make a difference. So it's not all the same, even though the three big strategy approaches are consistent across the globe, but what's within them varies by region and by country. So only, let's say in North America, I want to just talk for a few seconds on this one here, health education through the U.S. Health Head Start program. We have two approaches there. We work with UCLA, for example, to offer about 2-week program for folks who are delivering healthcare in the communities. And what we do, we take them through a 2-week of executive management training. But the unique here thing that we do in that program is really infuse health-related objective for those individuals. I was there 2 weeks ago. I gave a session which was about how can we help them to manage their energy, and which I'll talk a little more about that here. And I'll tell you, that made a huge difference looking at it from investing in their own well-being. The other program here with the Head Start program is also a unique one that I have seen really making a huge difference, is working certainly partnerships. We believe in partnerships. We do not believe that any program should be just run alone by Johnson & Johnson as a standalone. It should first fit within what is a current existing program and how can we infuse some of what we see might be add value to it. So, for example, the Head Start program has been in there for many years. This executive training is one. The other one is to address, the Head Start, coaches or parents and really train them how can they avoid taking children to hospitals unnecessarily by educating them on what they can manage on their own in the household versus taking them to the system unnecessarily. And I can tell you, and I'm not going to spend much time there, this program has been in place since 2001. And certainly we do quite a bit of outcome measures in most of what we do. Some we don't have it here, but for this program, for example, we have found visits to hospital emergency room dropped by 58%. Average number of days missed at school for children dropped by 30%. Average number of days lost at work was reduced by 42% for those who are the caregivers. So the impact could be transferable. The program can be transferable elsewhere, as you can imagine. Another example, which are quickly moving into Africa, and again, I'm talking about some program that I had kind of seen and visually visited. This one is about total control of the epidemic campaign. Is called the TCI program, which is in South Africa, really looking at the HIV/AIDS and how we can work with locals as well as other USAID and other organizations to actually create a person-to-person and a village-to-village type of a training program for those givers so they can educate the communities there about HIV/AIDS, how can they care for them. And it is a house-to-house type of approach. We certainly don't do that, but we do provide some of the coaches that address the need as well as really offer the material needed. Through this program, we have reached more than 4 million people since its inception many years ago. And it has been really a good example of partnership and what it can do. I visited some of those villages myself some time ago, and it was just really unbelievable experience to go through and see the impact business, government, as well as other partners can do. More here, but I selected few to share with you. This is a one we are just kind of embarking on right now, and I thought might be of interest. As I said earlier, we're focusing on mothers, children, unmet needs, as well as where we can make a difference. This one is an organization has been in place, Moms in Motion, where basically was established 14 years ago by really someone who thought about trying to bring moms who are very busy doing things, and how can you allow them to socially connect as well as to be out there and do some mission-driven approaches like running a 5K or doing half a marathon. And certainly now program network is 10,000 people are participating, moms that have a very busy schedule. Where we have involved with this program is actually adding what is called Moms in Motion, the energy program. And where we participated in that is we took about 125 moms that lead teams. So they are not just, that's a standalone, they lead teams. And we took them through a 10-week training, 1 day a week, of how can they try to establish their ultimate mission. I think the word purpose mission came up earlier. And really trying to dig deeper into why would they want to be healthy? Why do they want to complete the walk? And why do they want to complete that run? We took them through that, and then we measured their performance from their perception on their well-being, their perception on their energy level throughout the day through this approach. And I'll tell you, it's been really a great thing to see the results, energy level increase at the end of the day for all participants and their teams, energy improvement compared with baseline, certainly positive change in fitness and the health behavior. The program we run, it covers, it's called Energy Management, covers 4 dimensions, physical, nutritional, emotional, and mental aspect, and that's what they had to go through in the 10-week program through some of our performance coaches. More here, but I thought this would be a good, as we look at the issue of social connectivity, the social networking, but also through how can we get movement in that. This is just a simple example. Let me move quickly into a different approach, which really has to do how can we impact policies and how can we influence decision maker. We sit on what is called the Asia-Pacific Economic Cooperation, and we chair the industry under what's called the Life Science Innovation Forum for the last 4 or 5 years. One of the things here is really this covers government, 21 countries involved, including the U.S., and what we promote through that forum, and it's a tripartite forum where government has is one chair, academia is another one, and then industry is another. For the last 3 or 4 years, we have been representing the industry, co-chairing. One of the things we introduced there is about really breaking that barrier of trust of having public and private partnerships working with government and non-government organization. But the other piece to it was about how can we achieve the goal of sustainable and inclusive growth for those economies in Asia through health and innovation in the region. One of the results I'm very proud to report, we have renewed the focus on non-communicable diseases. We have renewed the focus on healthcare acquired infections, as well as now we're working on mental health action plan for the region, really breaking stigma on how to manage mental health and mental health related issues. Really, you can read through this, but certainly we created a forum where best practice can be shared among the countries or the economies, as they call, to share their practices and how other organizations and government could learn from that. Actually, we're gearing up. Our next meeting in China and Beijing will be in 2 weeks, where we will be going over some of those things moving forward. Another one, I know I'm running quick, but I thought I'd share a few more. It is, the issue of obesity and overweight has been addressed throughout the morning. This is a program where we again partnered with local health, state health departments, as well as with other organizations. Microsoft, for example, is part of that and helping us with the program, where we have in the last 2 to 3 years we have selected several school districts where unmet needs are there. These are somewhat really deprived communities where we have looked at their school system and tried to introduce the issue of providing physical activity, a burst of physical activity during their school day, and really see, does that make a difference? Does it make an effect on the school one behavior, performance, they're losing poundage or not, and their level of energy. And again, we started this Atlanta, Houston, Newark, and Philadelphia, 192 schools, certainly enabling 150,000 elementary school children in 3,000 classrooms, grade K-3, to burn over 150 million. You can read some of that. But the key point really to make here from visiting with them over the last year or so, the teachers themselves actually start to gain benefit from running the program because it helped them. How do we collect the data on the program? Certainly we are using external service provider ActivityWorks who deliver that curriculum to the student, but also Microsoft through the cloud collecting data on each of the groups that are participating and how they're doing. Last one, I promise. It is one area that is very close to what we do, and it's healthcare and healthcare systems. And it is about nurses. And you may have heard of campaign for nursing, the nursing future. We have been in this about 12, 13, or 14 years now, running the campaign. And it is really started by trying to encourage the career development for nurses and creating the importance of nurses in healthcare system and hospitals and in corporate world and other areas. And certainly right now it is even more valuable and much more even apparent the need for more in the nursing professional to really cover the gaps that are created with some of the unmet needs out there. Some of the things you see here that we have been able to see since the program was started 12, 13 years ago. Again, how many nurses really have been recruited and working for hospital systems and corporation, and definitely putting in some tools that nurses like to access, like discoveringnursing.com, which has been really viewed as the #1 nurses go-to for information. You can read through some of the output of what this program is about. Scholarships and grants, certainly it all has to do, again, with education and be the best they can be in their profession. And we see value of us doing this, again, and moving forward. I was asked to reflect on intentional strategies. So what you have seen before is intentional, but that's even more intentional when you look at put some measurement for our sustainability approach for 2015. We have what is called the Healthy Future 2015 goals. These are Johnson & Johnson publicly reported goals and objectives. And those three here were selected, looking at, specific things that we would measure against. And one has to do with really unmet need and eradicating intestinal worms where they are. And you could see 2013, we've been able to reach about 161 million doses provided to affected children in 16 countries. Advancing community wellness through health education. I mentioned some of those, and we count some of those towards these goals, but certainly here, health education for migrant children in Pujang. lastly, certainly about how many people have we reached, how many people we have touched through those programs and those community-related interventions, and certainly supporting the frontline health workers, J&J, is something we are very, very proud of. I'm going to close now by saying, and I want to close by taking you to the beginning, where basically it is really what matters to the business, what their value system is. We do believe, certainly, creating a healthier world, you can't start one community at a time. You have to create also an environment where businesses see what other businesses are doing, and actually the one that are doing good influence the one that have not been on that roadmap to get where they need to be. I do believe it is about partnerships. It cannot be done in isolation or in vacuum. So thank you for listening.